information to cover. So welcome to Understanding Alzheimer's and Dementia. My name is Brenda Dash, and I'm the Senior Wellness Education Manager for WorkWell NYC. And I just want to share a little bit about WorkWell for those of you who may not know. So WorkWell NYC is the city's worksite wellness program, and we're here with health and well-being resources and programs to help you live well and work well. Our goal is to create worksites that make it easier for you to live healthy, active lifestyles. And when we speak about health, health is not just the absence of disease, it is physical, mental, emotional, and we know that health exists on the spectrum. We are here with health and well-being resources and programs to help you move more, be well, eat well, and take action to prevent disease no matter where you are in your health journey. We're also committed to addressing matters of inequity and providing platforms to educate and develop structural solutions to health and wellness, both in and out of work. And I want to share that this year we're celebrating our 10th anniversary, and we're so happy to be able to offer these programs and resources to you and look forward to our continued relationships with city employees. So today we have an amazing webinar presentation, and I'm so happy that we were able to collaborate with both Alzheimer's Association as well as New York City Health, which is also, as many of you may know, Department of Health and Mental Hygiene. Before I pass on to today's panelists, which includes June Her from Alzheimer's Association, we have Katia, we have Chai, as well as Dr. Michelle Paggi. So before I pass on to our panelists, I do want to share that we do want to hear from you. So if you have any questions, please use the Q&A box to submit in your questions. And that way, at the end of the presentation, depending on how much time we have, the panelists will be able to speak on a few of the questions that are submitted. We also have a chat feature. So if there's any responses that the panelists ask from you during the presentation, please use the chat to provide your response. And lastly, I do want to share that we will record, or we are recording this presentation, and it will be shared with each and every one of you. So you will get a recording at the end. So with that, I do want to pass on to our panelists, and thank you. Looking forward to a great presentation.
I'll do a quick introduction of myself. Thank you, Brenda.
You're welcome.
I'll pull up the slides. So good afternoon, everyone. My name is June. I am a senior program manager with the Alzheimer's Association New York City chapter, where I do help with a lot of these education programming like today's, alongside some of our community educators like Katia and Chai today. I also do a lot of the support groups as well as information and resource finding. So of course, if you're ever in need of those kind of services, we have lots of different services, which we'll of course definitely talk about later on today. So definitely, again, please utilize the chat box or the Q&A box if you have any questions about that. And with this time, since I did pull up the slides, I will now pass over to Kat, who will talk about the impact of Alzheimer's dementia in our community.
Hi, everyone. I'm Kat. I work as a college aide at the Department of Mental Health and Hygiene. I recently got my master's in public health, and today I'm going to talk about the impact of Alzheimer's and dementia in our community. So a couple of Alzheimer's disease facts and figures that I want to highlight. This recently came out as of 2026. 1 in 3 older adults die with Alzheimer's or other dementia, and it kills more than breast cancer and prostate cancer combined. So this is a disease that is really increasing in prevalence as we see the general age of the population get older. Over 7 million Americans are currently living with Alzheimer's. That also extends to their caregivers, family members. Nearly 13 million Americans provide unpaid unpaid care for people with Alzheimer's or other dementias, and they provided more than 19 billion hours valued at over $446 billion. So this cost is expected to rise by 2050 to about 1 trillion. And some gender differences also exist. Nearly 1 in 5 women is the lifetime risk for Alzheimer's at age 45, and 1 in 10 for men. That's probably because women tend to live a little bit longer. And if we see on the bottom right, a lot of people know that lifestyle behaviors are really important, but less than half actually do those behaviors to reduce those dementia risks. So about the Alzheimer's Association, we lead the way to end Alzheimer's and all the other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Our vision is a world without Alzheimer's and all other dementia. So to give a little background on what dementia is and to kind of define it a little better, dementia is the umbrella term for loss of memory and other thinking abilities severe enough to interfere with daily life. So we like to say it kind of goes beyond just being a little forgetful. It severely impacts a person's life. So types of dementia include Alzheimer's, vascular dementia, Lewy body dementia, frontotemporal dementia. Alzheimer's is the most common. I think nearly 60 to 80% of the population is diagnosed with Alzheimer's, and also mixed dementias tend to be the most commonly diagnosed. So here are the 10 warning signs of Alzheimer's. So just to highlight a few, memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images or spatial relationships. So those are some that I just wanted to highlight, misplacing things and losing the ability to retrace your steps. So these are kind of the early warning signs that you should look out for in either yourself or a loved one, when trying to decide whether or not this is something that you should explore with your doctor. Okay, the importance of early detection: to pay attention to any changes in memory, thinking, or behavior that you notice in yourself or someone else. A lot of the times we like to say whatever is different for you. You may just naturally be a little bit forgetful, but if you're someone who's very on top of paying bills or taxes or things like that, noticing changes that deviate from what you would typically expect from yourself or others. If you see changes that are new or unusual, taking action by having a conversation with a doctor or a trusted family member or friend. Sometimes some people even may be approached by a loved one or a family member and ask, we've noticed this and this, like what are the next steps we can take, and taking those steps to maybe talk to your doctor. So you can take charge of your brain health. There are several risk factors for cognitive decline and dementia, some such as age, which we can't control, but there are actions we can take to improve our brain health. So we call those modifiable behaviors, things that we can actively change and adjust. Growing evidence shows that healthy living can lower the risk of cognitive decline and possibly dementia. It can't be 100% prevented, but again, with these modifiable risk factors that we change in our daily life, behaviors that we can change like diet, exercise, managing chronic conditions, things like that, we can lower our risk. So our brains need to be taken care of at all ages. It's never too early or too late to take action to protect brain health either. So the US Pointer Brain Health Recipe, this was a study that was done many years ago, and participants followed either a self-guided or structured lifestyle program. The two interventions focused on similar domains, but this is kind of the recipe for early detection and prevention, or risk reduction, sorry. So it's cognitive exercise, nutrition, health monitoring, and physical exercise. So getting 30 to 35 minutes of moderate to intense aerobic activity 4 times a week. Cognitive exercise, your brain is a muscle, just like any other muscle. We need to work it and really try to work our brains out. So computer-based brain training programs 3 times a week for 30 minutes, or regular engagement. A lot of people like to do puzzles or crosswords, or think reading is really good. Nutrition is also really important. Adherence to the MIND diet, which emphasizes dark leafy greens, berries, nuts, whole grains, and limiting sugar and unhealthy fats. Even though it's good, we still have to be mindful of the things that we eat, especially now in younger age or even older age, and health monitoring. So regular check-ins on blood pressure, weight, and lab results, and managing other chronic conditions like diabetes, heart disease, things like that. So 10 healthy habits for your brain that we always like to say are challenging your mind, protecting your head. If you're someone who rides bikes or scooters often, really making sure that you're protecting your head. Or if you're someone who is in need of an assistive device like a walker or a cane, making sure that you use those things. Being smoke-free and tobacco-free, controlling your blood pressure. Also, one thing about being smoke-free and tobacco-free, I just want to highlight that it's also never too late to quit. There's really, it's the right time is now. You know, if you thought you should have done this years ago, I just want to emphasize that it's never too late to start new habits, like being smoke-free, controlling your blood pressure, get moving and exercise, sleeping well, getting quality sleep, 6 to 9 hours, I believe, maintaining a healthy weight, managing diabetes, eating right, and staying in school. Education is one of the biggest indicators of reduction, risk reduction for dementia. Okay, I'm going to pass it off to Chai now for understanding Alzheimer's and dementia, and she'll talk more about that.
Hello, everyone. I'm Chai Crawford. I am a community health worker at New York City Department of Health. I am with the REACH team as well as the aging unit, the healthy aging unit. And so I partner with June in being um, a community educator with Alzheimer's, and it's great to meet you all. So, in today's section, we will be focusing on understanding Alzheimer's and dementia, which is another program that's presented by the Alzheimer's Association. So, today we're going to take a top level look at Alzheimer's and dementia and give you a broad understanding. And by the end of today's program, the goal is for you to be able to, one, compare Alzheimer's and dementia, two, recognize how Alzheimer's disease affects the brain, three, list the risk factors of Alzheimer's disease, four, identify the three stages of this disease, recognize current FDA-approved treatments, describe how scientists are working to advance research, and finally, name the resources available through the Alzheimer's Association. So you may hear the term Alzheimer's and dementia used interchangeably. They are related, but they're different. In this section, we're going to discuss both Alzheimer's and dementia and how they're related. But before we begin, let's take a moment to test your knowledge about Alzheimer's disease. So you can put this in the chat. Alzheimer's, what you think the answer is? Alzheimer's is a normal part of the aging process, true or false? Seeing a lot of false. Okay, you true. And that is false. Alzheimer's is a brain disease that causes problems with memory, thinking, and behavior, but it is not a normal part of aging. So Alzheimer's disease is, oh, oh, sorry, we've gone on to the next one. Okay, so the next true or false. People younger than 65 can develop Alzheimer's. Is this true or false? Definitely true. While most individuals living with the disease are older adults, people younger than 65 can also develop Alzheimer's. This form of the disease is known as younger onset Alzheimer's, sometimes called early onset, and in some cases, people develop the disease in their 40s or 50s. So there are many causes of dementia. Dementia is an umbrella term for the loss of memory and other thinking abilities severe enough to interfere with daily life. There are numerous types of dementia, and each type has different causes and symptoms. These listed are just a few classifications, while Alzheimer's is the most common, and Alzheimer's disease accounts for 60 to 80% of these cases. So, as discussed, Alzheimer's is a brain disease. The brain is our most complex organ. It is also our most powerful, despite weighing only about 3 pounds. So, now we're going to hear from one of our experts about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
So, everyone with the brain is at risk of developing Alzheimer's disease. There are a few known factors that increase a person's risk of developing Alzheimer's disease. So, let's see if you know which one is the most common. So, what is the greatest known risk for Alzheimer's disease between genetics, family history, and age? So, all of these are known risk factors, but the answer that's true would be age. After age 65, the risk of developing Alzheimer's disease doubles every 5 years. So, more than a third of people age 85 or older are living with the disease. Okay, so Alzheimer's disease involves the failure of nerve cells, the exact cause of which is still uncertain. However, research has identified risk factors that increase the likelihood of developing Alzheimer's. Age is the greatest known risk factor for Alzheimer's. An individual's risk for developing the disease increases at age 65. Family history is a known risk factor. Having a parent or sibling with the disease increases an individual's risk. Two types of genes are associated with Alzheimer's: risk genes and deterministic genes. Let's take a look at some populations who are at a high risk for developing the disease. In addition to the main factors for the general population, Black Americans, Hispanic Americans, and women are at a higher risk for Alzheimer's. Research shows that Black Americans are about twice as likely as white Americans to have Alzheimer's or other dementias, and Hispanic Americans are 1.5 times as likely. The reason for these differences is not well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. Women are more likely than men to develop the disease. Nearly 4 million American women are living with the disease today. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain this difference. Researchers are exploring how genetic differences between men and women may impact disease risk. Information about Alzheimer's disease in different populations comes from the Alzheimer's Association Alzheimer's Disease Facts and Figures report, which is available at alz.org/facts. No two individuals experience the symptoms and progression of Alzheimer's disease in the same way. So now we're going to hear from an individual describing what it is like to live with dementia.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Progression of Alzheimer's disease from brain changes that are unnoticeable to the person to brain changes that cause problems with memory and eventually physical disability is called the Alzheimer's disease continuum. On this continuum, there are three broad phases shown on this slide in teal, orange, and purple. The first phase is called asymptomatic, and in this phase, there may be changes in the brain long before a person begins to have symptoms or gets a diagnosis. As the disease progresses, a person will begin to experience mild symptoms, but will still be able to independently perform most activities of everyday living. In this phase, the person may be diagnosed with mild cognitive impairment or MCI. In the graph shown on this slide, MCI is an early stage of Alzheimer's disease, meaning hallmark changes in the brain, such as amyloid buildup, are present. MCI can develop for multiple reasons, and individuals living with MCI may go on to develop dementia due to Alzheimer's. Others will not. In the third phase, people who do develop dementia due to Alzheimer's will experience more serious changes in memory, thinking, and behavior. This phase is further broken down into stages called mild, moderate, and severe, sometimes referred to as early, middle, and late. These stages reflect the degree to which symptoms interfere with the person's everyday activities. And it is important to understand that the stages of Alzheimer's are general, and because each person living with the disease has a unique experience, we can't always neatly place an individual into one specific stage. In fact, some people may exhibit symptoms that overlap stages. However, the stages do allow you to gain a general understanding of the progression of the disease. As Alzheimer's progresses, the individual's behaviors will change, as does the role of a caregiver. These stages can help caregivers prepare for what to expect and understand how to respond. Now we will discuss FDA-approved treatments. So you do need to talk to a healthcare professional. Current medications cannot cure Alzheimer's, but there are treatments that change disease progression. There are also drugs and non-drug options that may help treat symptoms such as memory loss and confusion. Treatments may be administered as a pill, patch, or intravenously. These treatments work in varying degrees and are not effective for everyone. Have a conversation with the healthcare professional to determine whether a specific treatment is appropriate. And you can learn more at alz.org/treatments. In the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain. Many recent insights point toward promising new strategies for treatment, prevention, and diagnosis. Where were we? So Scientists, just to recap where we are with Alzheimer's research, scientists have increased their understanding of Alzheimer's significantly over the past decade. People living with dementia, caregivers, and healthy volunteers without dementia are needed for clinical studies in order to find methods of prevention, treatment, and ultimately a cure. Clinical studies may provide participants with cutting-edge treatment and additional medical care. Trial Match is a free clinical studies matching service for people interested in participating in Alzheimer's research. Alzheimer's is difficult, however, no one has to face the disease alone. Let's learn a little more about Alzheimer's Association and how we can help individuals and families across the country. The Alzheimer's Association is in communities across the country, providing direct services to individuals and families facing the disease. The association is available wherever and whenever you need reliable information and support. 3 of our key resources that can connect you to information and support include our free 24/7 helpline, with the number listed above. You can call anytime, day or night, to receive information and support. We provide access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. These are master level clinicians that are available around the clock to provide in-depth care consultations, a free of charge care navigation service offered to families at any stage of the disease, and help is available in more than 200 languages. Next is our website, alz.org. That's often the first stop for individuals following a diagnosis of Alzheimer's or another dementia. And it includes sections specifically for people living with the disease and caregivers. And now the Alzheimer's Association and AARP Community Resource Finder is a wealth of community-based resources available in your area, including long-term care and community-based services, local association offices, and their offering of programs and support services. So visit alz.org/CRF. Now I
Okay.
believe Michelle. Yeah.
Hello, everyone. So after hearing all this information about Alzheimer's and other dementias, you're probably wondering, like, well, what is New York City doing, New York City Health Department doing about this? Well, we have a program that is addressing brain health for all New Yorkers. Next slide. So this the BOLD stands for Building Our Largest Dementia Infrastructure. We're a CDC funded program, and we are here to promote the brain health of all New Yorkers and enhance the health and well-being of everyone who's impacted by dementia, including dementia caregivers. We use a public health approach following the CDC's Healthy Brain Initiative roadmap. Next slide, please. And we are one of 43 awardees in 2023. So we are in the middle of year 3 of our 5-year grant. We spent the first 2 years capacity building, and that included building up our coalition, which now has over 60 members. And we are 3 years of our 5-year grant are dedicated to implementing the strategies outlined in our strategic plan. We are within the Health Department's Center for Health Equity and Community Wellness within the Healthy Aging Unit. Next slide, please. So we conducted a needs assessment at the end of 2024, and we were able to get 464 respondents, including people living with dementia, caregivers, and healthcare providers. So the majority of the respondents, 84%, were either somewhat or very familiar with signs and symptoms of dementia, whereas 68.5 were somewhat or very familiar with risk factors, and 38.4% were aware of dementia-related services in their communities. So there's a lot of room for growth in terms of promoting public awareness and awareness on the part of healthcare providers for regarding the risk factors for dementia. And also, the fact that under 40% of respondents were aware of dementia-related services, this means that we need to do a better job of promoting these services to people who need them. So next slide. So our strategic plan focuses on the following: risk reduction, which entails reducing dementia risk factors throughout the whole lifespan. Like we said earlier, it's never too early or too late to increase your brain health, as well as promoting public awareness of dementia and brain health. We also want to promote early detection and diagnosis. So early detection means that, so detecting dementia is recognizing that there is something wrong with someone's brain function. Diagnosis is what occurs in a healthcare setting. And in a lot of cases, it's a primary care provider making the diagnosis. So primary care providers are the first line of defense when it comes to the process of ensuring people with dementia get treatment. So often, we want to make sure that primary care providers have the skills and resources that they need in order to make these diagnoses and referrals to specialty care. We also want to make sure caregivers have what they need as well. And this includes home health workers, professional caregivers, and family caregivers. We also want to increase community clinical linkages, meaning connections amongst healthcare systems, community-based organizations, and other settings. Next slide, please. So our coalition, we actually have over 60 members now, and these include folks from public health, healthcare, and community-based organizations. We also collaborate and resource share. We convene our diverse partners to promote collaboration and leverage our shared resources. We also engage in education of our coalition members to make sure that our coalition members are up to date with regard to their knowledge of dementia. We also focus on implementation, meaning we execute the strategies and activities in our strategic plan. Next slide. So this is our timeline for this grant year. So as you can see, we're in the implementation phase, like I mentioned. We also we aggregate resources and materials in a central location, and we're always recruiting new coalition members. And at the end of this presentation, you will get some information on how to join our coalition if you're interested. Next slide. These are some photos of us doing our community engagement work last summer. So you can see Chai giving a presentation at an older adult center. And you see 3 of our team members in the middle tabling at the Brooklyn Neighborhood Health Center. And you also see one of our tables at one of the community health fairs. Next slide. So to sum up, our program promotes the brain health of all New Yorkers, and we use a public health approach. And we are transitioned from capacity building to implementation. So we're going to continue implementing our activities in our strategic plan. And we are, right now, we're conducting learning collaboratives with our coalition members. Next slide. So if you would like to join our coalition or find out more information about our program, you can email us at brainhealth@health.nyc.gov. And we're looking forward to hearing from you. Thank you.
Great. Cool. Thank you so much, Michelle. Yes, absolutely. If you have any questions about that, please definitely feel free to put that in the chat, or also please feel free to reach out to either Brenda or Michelle themselves. We'll have some time for questions. I thank you to my colleague Gladys, who has been helping me answer a lot of the questions. And thank you everyone for putting a lot of the questions in the Q&A portion. There might have been some questions that may have gotten lost in the webinar chat. So if you did see that you submitted a question, but it got overrun because we were answering true or false questions, just head over to the Q&A button and just resubmit the question there if you haven't seen one. Great. And Michelle did put her contact in the chat, so definitely feel free to reach out. And I'll actually also put my contact in the chat as well. If you ever have any questions, if you're ever interested in hosting another one of these education programs anywhere else in the community, we're always open to doing a lot of the work for the community. And of course, as a nonprofit, we are always trying to reach as many communities as possible with free and accessible Alzheimer's dementia awareness and brain health. So let me just quickly put my email in the chat. And I did mention this in the before too. Brenda will be sending out the resources after today's program. I equipped her with that already. So, let's see. So I did see, I was taking a quick look at the answered questions. A lot of the questions did talk a little bit about reading. Does reading content matter? What about like reading novels because it requires more brain work? Yes, absolutely, right? The more that we are challenging our brains with a lot of new stimuli, right? For example, it could be reading a new book or, reading an ongoing series where they keep constantly introducing new characters or a new storyline. Or if it's even something as simple as, building something from IKEA, that's really challenging. I know I have a lot of trouble with that. Or if it's, learning a new language or doing a crossword puzzle, or even, just simply, writing a tough email, right? These are all things that are challenging our brains. And ultimately what whatever we're doing to challenge our brains is ultimately pumping blood from the heart to the brain, which then is also exercising the brain. So thank you for all those questions. All right. So I did see another question that's talking about what is sundowning. So let me click answer live. So sundowning is the increased confusion when it is towards nighttime. We typically see that a lot more with people who are living with dementia, specifically in the wintertime, especially after daylight savings. There could be more of that increased or restlessness. There could be the increased confusion of, where to go, what to do, what does this specific item do, all that stuff, right? And of course, with the disease, there could be some of that, specifically with memory and also behaviors as well. Oh, and thank you, Gladys. Yes, she actually put the link on sundowning in the chat, in the Q&A. All right, let's see. Sorry, okay. The link to nutrition, absolutely, right? So we did talk about nutrition. Oh, sorry, let me also make sure that I leave the key resources up in case anyone wants to take a picture. But in regards to nutrition, of course, right, we do see that there's like the DASH diet, the Mediterranean diet, the MIND diet, which is specifically for lowering the risk of dementia. There's so many different research on, what Kat said before, on leafy green vegetables, lean meats, poultry, whole grains, nuts, beans, limited sugar, limited salt, healthier fats like extra virgin olive oil instead of butter. These are all things that could help to potentially lower the risk of dementia, and also not even just Alzheimer's and dementia, but a lot of the other health conditions to think about, right? Absolutely. I do have a question about BOLD. If Michelle, you can answer. Could BOLD come to a skilled nursing facility?
Yeah, I mean, it's we have some capacity to do community education. So yeah, just send an email to our email address, and we'll talk more.
Great. Thank you, Michelle.
Yeah.
All right. Lots of things about medication. So when we are talking about medications, any type of medications, or even, I guess, supplements and vitamins, always, we're going to talk with the doctor before we start taking any new medications. And also, we want to do our own research too. I know on our website, alz.org, we have a specific one for just treatments. So with treatments for Alzheimer's and other types of dementia, we do have those medications that help with the symptoms. And the most two recent ones that we had in the past 3 years, for the first time ever, we have two medications that are IVs that can help slow down the progression of disease in the early stages. But in regards to vitamin supplements, always, again, if it works for one person, it might not work the same for you, right? Because again, everyone's taking different types of medications. Everyone has different types of considerations, whether that be medical conditions or family history, or if you are consistent alcohol drinker, or all these different factors do play into part whenever we are talking about anything like that. So my general answer for that is always you want to speak with typically a physician, geriatrician, or even a nutritionist if you're really curious about what kind of deficiencies you might have in your nutrition. All right. Let's see. Have social interactions have been proven to improve brain activity? Yes, absolutely, right? When we have seen research where, people who are put into isolation versus those who might be out and about, those who do have strong social interactions, whether that be at a senior center or a social club, or if you're listening to me talk about Alzheimer's dementia, or you're listening to Kat and Chai about Alzheimer's dementia, right? These are things that can help to improve brain activity and also just your overall health too, right? Because humans are social creatures, right? Humans need other people to do many things, and social interaction does play a part in lowering the risk of Alzheimer's dementia. Ooh, okay, sorry, I see some coming in the chat itself, so let me make sure that I am addressing everything. I just mentioned that there are two drugs. Oh, yes. Oh, actually, Kat, thank you. Yes, Leqembi and Kisunla are the two medications that can help in the early stages of dementia. Perfect. see. Okay. Oh, all right. I think I addressed most of the ones in the chat. Let me go back to the Q&A. Thank you, everyone. Let's see. So for cognitive testing, you can even also use our community research finder, but you can also take into look at different diagnostic centers. Of course, you can also go to your physician, who will probably most likely refer you out to either a psychiatrist, psychologist, geriatrician if you're over the age of 60. But there are those diagnostic centers specifically for testing as well. Lots of information about engagement, going to senior centers, reading a lot, absolutely.
Well, June, what I'm going to do, I'm going to jump in, and as you're still scrolling through the questions, just in case there's any others, I am going to I'm going to launch a poll because we want to hear from you. This is a great way for us to be able to assess what we're doing, if these are programs that you want to come back to. So let me just launch a poll so we can hear from you. And first one will be our knowledge poll. And did participating in this program increase your knowledge? So please, if you're able to, respond to the poll so we will be able to know. Did you learn something new? You're not seeing the poll? Oy. Relaunch, let's see. All right, let's see. All right. Now you can see. Perfect. Thank you for letting me know. And thank you for responding to it. Great. All right, gonna give it a few more seconds. All right, so we got perfect. And then I'm gonna go back and program satisfaction. I'm gonna, all right, very good. Thank you for this. This is great information and truly is helpful. So thank you for answering. And I promise we will get to any other questions that you potentially submitted in a few seconds. Gonna give it a few more seconds. All right. Thank you again for responding. And I just want to share, Michelle had indicated resources that are available for New York City Health. And we also wanted to share information. Let me allow. Give me 1 second. Slideshow, concurrent. For services that are also available for all city employees as well as their families from New York City Employee Assistance Program, which is our EAP. Again, they are available to you as city employees as well as family members. They currently offer sessions via phone and or video. You can contact them. And again, this is if you're dealing with dementia, if you're dealing with a family member who has dementia and you want that additional support, New York City EAP or our EAP department definitely can provide services to assist. So they have a number 212-306-7660, or you can email them. And this information will be shared as a follow-up following today's session. And I just want to provide a little bit of information regarding our upcoming events. This is May, so it is Mental Health Awareness Month. And we have an amazing Breathe and Be meditation challenge that's going on. It did start earlier this week, but there's no start when it comes to wellness. You can join at any point. So if you're interested in learning about the practice of meditation and participating in engaging sessions and receive emails, please look to register for this great, exciting programs. And likewise, next month is our Artist Life annual event, which is an amazing opportunity for you to come and see your co-workers' creativity. There will be performances, there will be visual arts, literary works, all at a venue or an art studio downtown. We would love to see you. There's many opportunities during the day as well as the evening for you to participate in this great event. So please, if you get the opportunity, come and visit. You'll be shocked at the amazing immense of talent that we have here. If you want to know about additional programs that WorkWell is offering, please sign up to our mailing list. And there are other opportunities for you to be in contact with us. We have email, we have websites, we have LinkedIn, we're on YouTube. So the list goes on. Don't be a stranger. Again, we're here to provide resources and well-being programs. We're celebrating our 10th year. So we're so happy about this journey and this collaboration. And please, don't be a stranger. So I do want to ask June if you have any other things that you wanted to share.
There we go. I did answer most of the questions. For the slides and presentations, the stuff will be sent out in an email afterwards. I don't believe we're able to share the slides, but there will be in replacement of that, a brochure that has everything that we actually did talk about, including all the links and resources. So it's basically the same thing, just in a pamphlet form as a PDF. So yes, and in a sense, you will get those. Brenda will be sending those out.
Definitely.
Can I
Yes.
say something?
Wait, sorry.
Gladys.
Yes.
So I don't want you to think that the helpline is just for help if you have somebody that you're taking care of dementia. A lot of these questions that you have asked us today, you can call that helpline to ask anything from, questions about the disease. Where do you go to get help? Where do you find an adult day center? Where do you find a doctor? Those can all be answered at the helpline.
Absolutely. Yes, indeed. I'm gonna double down on that, Gladys. Yes, the 24/7 helpline is not just for caregivers, it's for honestly anyone, whether you're a professional that handles clients who may be going through dementia, or if you are going through personally, or if you know of someone else, or if you just want to know more in general. We definitely have 24/7 helpline available whenever. And again, we're a nonprofit, so everything is for free. So definitely utilize that. And then there was also another question in the chat too about, I know today's presentation was a little bit more about introductory, it's more sort of introductory, just learning about what is Alzheimer's, what is dementia, what those facts and figures look like, and why it's important to get an early diagnosis. But someone did mention in the chat that, because the topic is so broad, it's impossible to cover in more detail. And that's so true, because Alzheimer's dementia, there is well beyond the A through Z's. It goes into the 1, 2, 3s too. So, but what we do have at the Alzheimer's Association is we have lots of different topics. Today's topic was just one of the many ones. Some examples that we have that we offer monthly to virtually and also in person in the community. Some examples are like respond to dementia-related behaviors, how to effectively communicate with someone living with dementia, what are the 10 warning signs. We also have something in general, more so about building brain healthy habits for anyone to attend. Actually, all of these programs is for anyone to attend. So yes, I'm just gonna, we have lots of different resources, and yes, you're right. The topic is very broad, so had lots of stuff.
Well, thank you. Thank you so much, both Alzheimer's Association as well as New York City Health. It was truly very special to be able to collaborate with you on this special or important topic. And hopefully we can keep the conversation going and potentially see what else we can bring around the topic of dementia as well as Alzheimer's. So thank you, and thank you to all of you for participating in today's program and keeping it as engaging as it was. We wouldn't be able to do it without you.
Thank you, everyone.
Thank you.
Thank you, Brenda.
You're welcome.
Thank you,
Thank you,
Chai.
Brenda. Thanks, June. Thank you,
Thank you,
everyone.
Kenneth. Thanks, Michelle. Thanks, everyone.
Bye.
Bye-bye. Thank you, everyone.
Bye.